Now to the nationwide outbreak of Cyclosporiasis, that parasitic infection making people very sick. Since May, the Department of Health says New York State has 517 reported cases. 374 of them are here in the city. Health reporter Jenna DeAngelis spoke with a man from Queens who spent weeks suffering from the illness.
I felt really lethargic, nauseous, had a low-grade fever, had diarrhea.
When Chase Strangio began experiencing these symptoms in May, he thought he had a stomach virus. But as the days progressed, he didn't.
My body would not allow me to eat food, and it even reached the point where drinking water was challenging, and I was having a lot of pain.
No one in his family got sick, but many friends he had lunch with a week prior did.
The common ingredient we were able to discern was either a lettuce or a cilantro.
Research led the New York City attorney to request a stool test, which came back positive for Cyclospora, the parasite which causes the intestinal illness Cyclosporiasis. Cases have been identified in 34 states since May 1st. Nearly 400 have been reported in New York City alone.
This is 3 times the amount of our typical rate.
The CDC has not yet confirmed a specific source for this outbreak, but past outbreaks have been linked to various produce such as raspberries, leafy greens, onions, basil, and cilantro.
The actual parasite lives on the outside of those fruits and vegetables. And so we're working with our colleagues at the federal government and at the state to identify, is there one retailer or wholesaler upstream that is particularly causing this.
Mount Sinai South Nassau Chief of Infectious Diseases, Dr. Aaron Glatt, says it's not about avoiding fruits and vegetables, but handling them properly.
Cooking them or making sure that they're washed well should be adequate. You know, if people are just going to eat junk food, that has its risks too. And I think having a well-balanced diet is something that's very important.
The doctor also wanted to stress this is not spread from person to person. It is important to note it can take up to 2 weeks for symptoms to appear, and the CDC says they can last longer without treatment. So if you think you're infected, seek medical care. You can be put on an antibiotic, which is what Strangio did, and I'm happy to report he is feeling much better. Christine.
All right, great information there, Jenna. Thank you.